Hi, Dr. Brian Kaufman, a retired family doctor and the co-founder, Executive Vice President and Chief Medical Officer of the nonprofit CLL Society. And I'm going to present some research presented at the International Workshop on CLL in 2023 on whether we can use surrogate markers to speed up clinical research in CLL. The bottom line on this study was that progression-free survival in minimal or measurable residual disease status was found to strongly correlate with overall survival, suggesting that these markers could be safely used as surrogates for overall or OS, overall survival or OS, and thus provide quicker results in clinical trials. The research was presented by Florian Simon, a doctor at the Faculty of Medicine at the University Hospital in Cologne, representing her colleagues from the German CLL study group at iwCLL 2023, held October 6th through the 9th in Boston, Massachusetts. In the way of background, improvements in overall survival, or simply just living longer, should be the primary endpoint of all CLL patients, and it's considered the gold standard in all cancer trials. But its practicality and relevance in CLL is suspect for several reasons. First, many CLL patients are older, have significant other comorbidities or illnesses that contribute to their deaths unrelated to CLL and can mess up the overall survival data. Second is the high efficacy, the great responses and durable responses we get from targeted therapies demands increasingly long observation times to see if there's any differences in overall survival. And thirdly, following up on that, we have excellent salvage therapies that are available at least for second-line relapsed refractory disease, making measuring overall survival an even lengthier process, and recognizing that it's not just dependent on what that first treatment that's being studied is, but what that follow-up study is. Therefore, surrogate endpoints are commonly used in CLL research, but are often not accepted by the FDA and other regulatory agencies due to the lack of demonstration of a tight connection with overall survival. Common surrogate markers that are used are PFS, progression-free survival, overall response rate, OR, or complete response, CR, or minimal or measurable residual disease, MRD. The method used in this was to study over 4,000 patients in 12 phase 2 and phase 3 trials done by the German CLL study group between 1999 and 2022. Only data was gathered from those receiving frontline therapies. So there was a total of 4,237 patients with a median observation of 67 months. The median age was a little young for CLL, 64%. 3/4 of the patients, 3,159, had received chemo or chemoimmunotherapy. Remember, this data was looked at from 1999, so before the era of targeted therapies. 1/4, or 1,078 of the patients, received targeted therapy. There were 2,114 incidences of progressive disease and 1,211 deaths captured within the trial data. Patients with a confirmed overall survival event. For those patients, the correlation between progression-free survival and overall survival in months was 0.66 for patients receiving chemoimmunotherapy and 0.88 for patients receiving targeted therapy. This is an excellent, tight correlation, especially for those receiving targeted therapies. There was another interesting data point here. The median overall survival for those who reached undetectable or nearly undetectable, what we call intermediate MRD, measurable residual disease, was not reached and was 60.7% for high MRD status. The estimated 60-month overall survival was 84.6%, 71.3% and 51% respectively for those reaching UMRD, those reaching intermediate MRD, and those reaching high levels of measurable residual disease. So what are our conclusions? In these 12 clinical trials, there was a strong correlation between progression-free survival and overall survival, especially among those CLL patients using targeted therapies. This finding supports the use of progression-free survival as a quicker, faster surrogate outcome measure in CLL trials, hopefully allowing for more accelerated drug approval. MRD, measurable residual disease, at the end of treatment was associated with overall survival across all treatment modalities. Its prognostic utility urges its use in planning disease management decisions, both inside and outside of clinical trials. Thanks for listening. Stay strong. We are all in this together.